What do doctors recommend for back pain relief? While the experience of back pain can be highly individual, doctors generally recommend a combination of lifestyle changes, physical therapies, medications, and in some cases, more invasive interventions to help manage and relieve pain. Understanding these recommendations can help patients make informed decisions about their care. One of the first steps doctors often suggest is modifying daily activities. This includes avoiding movements that worsen pain, such as heavy lifting or sitting for long periods. Maintaining proper posture, especially while sitting at a desk or using a computer, can significantly reduce strain on the back. Many doctors also recommend ergonomic adjustments at workstations and at home to support spinal alignment. Exercise and physical therapy are also widely endorsed. Gentle activities such as walking, swimming, or yoga can help improve flexibility, strengthen the muscles supporting the spine, and increase blood flow to the area, which promotes healing. Physical therapists can tailor specific exercises to a patient's needs, helping to strengthen the core, muscles, and reduce the likelihood of future pain episodes. Stretching exercises targeting the hamstrings, hips, and lower back are especially effective. Over-the-counter medications such as non-steroidal anti-inflammatory drugs and NSAIDs like ibuprofen or naproxen are often recommended for managing mild to moderate pain. These medications help reduce inflammation, which is a common cause of discomfort in back pain. For more severe cases, a doctor might prescribe stronger medications, such as muscle relaxants or even short-term opioid use, though the latter is approached with caution due to the risk of dependence. In addition to conventional treatments, doctors may recommend alternative therapies. Chiropractic care, acupuncture, and massage therapy have been shown to provide relief for some individuals. These therapies can complement traditional treatments and offer additional comfort, especially when performed by licensed professionals. In persistent or severe cases, more advanced treatments might be necessary. This can include spinal injections, such as corticosteroids, which target inflammation directly at the source. For chronic or debilitating pain that doesn't respond to other treatments, surgical options like discectomy, laminectomy, or spinal fusion may be considered. However, surgery is typically reserved as a last resort due to the risks and recovery time involved. Importantly, doctors emphasize prevention as a key aspect of managing back pain. Maintaining a healthy weight, staying physically active, using proper body mechanics when lifting, and quitting smoking are all factors that contribute to back health. Smoking, for example, can reduce blood flow to the spinal discs, making them more prone to injury. In summary, doctors recommend a multifaceted approach to back pain relief, combining lifestyle changes, physical,